Pregnancy and Heart Failure, What Every Mother Should Know by Robert Autry, MD, MSc. Welcome back to HeartyHealthMD. Did you know that pregnancy can sometimes affect the heart in unexpected ways? There is a rare but serious condition called peripartum cardiomyopathy, where the heart becomes weakened during the last part of pregnancy or shortly after delivery. Although it is uncommon, recognizing this condition early can be life-saving for both mother and baby. In this video, we'll explain what peripartum cardiomyopathy is, why it happens, who is at risk, and what symptoms to watch for. So what is peripartum cardiomyopathy? Peripartum cardiomyopathy, often called PPCM, is a rare form of heart failure that occurs during the last month of pregnancy or within 5 months after delivery. Heart failure does not mean the heart stops beating. Instead, it means the heart muscle becomes weak and stiff and cannot pump blood effectively enough to meet the body's needs. Doctors diagnose peripartum cardiomyopathy when heart failure develops near the end of pregnancy or shortly after delivery, when no other cause of heart failure is found, and when the heart's pumping ability is reduced, usually with an ejection fraction below 45%, meaning that the heart squeezes less than 45% of the blood into the body with each heartbeat. This means the heart is not pumping blood as efficiently as it should. Why pregnancy affects the heart? Pregnancy causes major changes in the cardiovascular system. In fact, pregnancy is often described as a natural stress test for the heart. During pregnancy, blood volume increases by about 50%, the heart rate increases, the heart pumps 30 to 50% more blood during pregnancy, and blood flow to the uterus increases to support the growing baby. These changes are necessary for a healthy pregnancy, but they also mean the heart must work significantly harder than usual. For most women, the heart adapts well. However, in rare cases, the heart muscle may weaken, leading to peripartum cardiomyopathy. When does PPCM occur? Peripartum cardiomyopathy is uncommon before 36 weeks of pregnancy. Most women develop symptoms late in pregnancy or during the first month after delivery. In many cases, symptoms appear after the mother has already gone home from the hospital and then returns with shortness of breath or swelling. So who is at a higher risk? Peripartum cardiomyopathy occurs worldwide and can affect women of all ethnic backgrounds. However, several factors increase the risk, including age over 30 years, African ancestry, pregnancy with twins or multiple babies, high blood pressure during pregnancy, including preeclampsia, and having 4 or more pregnancies. Interestingly, although multiple pregnancies increase risk, many women who develop PPCM experience it during the first or second pregnancy. In the United States, African American women are frequently affected and may develop more severe disease, possibly related to genetic factors and healthcare disparities. So what causes PPCM? The exact cause of peripartum cardiomyopathy is still not fully understood. Researchers believe it likely results from a combination of factors, including hormonal changes related to pregnancy, genetic susceptibility, inflammation of the heart, also called myocarditis. These factors together may weaken the heart during or shortly after pregnancy. Symptoms to watch for. The symptoms of peripartum cardiomyopathy are similar to those seen in other forms of heart failure, including shortness of breath, fatigue or unusual tiredness, swelling in the legs or feet, persistent cough, difficulty breathing when lying flat, waking up suddenly at night feeling short of breath. Because pregnancy itself can cause swelling and fatigue, these symptoms can sometimes be mistaken for normal pregnancy changes. However, symptoms that are severe, worsening, or unusual should always be evaluated by a doctor. Doctors use several tests to diagnose peripartum cardiomyopathy, including an electrocardiogram or EKG to evaluate the heart rhythm, an echocardiogram, which is an ultrasound of the heart that measures how well the heart pumps, and blood tests like BNP, which can indicate stress on the heart. The echocardiogram, or echo, is especially important because it shows whether the heart's pumping function is reduced. Treatment mainly focuses on managing heart failure and helping the heart recover. The goals of treatment include relieving symptoms, reducing fluid buildup in the lungs, improving heart pumping function, and preventing complications such as blood clots. Treatment is similar to that used for other types of heart failure, but doctors must be careful because some medications are not safe during pregnancy. After delivery, treatment options may expand depending on whether the mother is breastfeeding. In conclusion, peripartum cardiomyopathy is rare, but it is an important condition to recognize. Pregnancy places significant stress on the heart, and symptoms such as shortness of breath or swelling should never be ignored. With early diagnosis and proper treatment, many women recover and go on to live healthy lives. Thank you for watching. To learn more and live healthier, find us at HeartyHealthMD on YouTube. If you found this helpful, please like, share, and subscribe to support your heart health.